Hi, my name is Suhan, Doctor of Physical Therapy. Today I want to show you some exercises that you can do when you have clicking during shoulder movement. When I see patients with shoulder pain, regardless whether the clicking causes pain or not, I always try to assess the proper position of shoulder joint and the scapula bone, or in other words, shoulder blade, to make sure that they're properly aligned. Very often the clicking happens with abnormal stability of scapula bone, which is termed scapula winging. There are two types. The first one happens when the bottom side of your scapula bone goes downward, moving closer to your spine, and that is called medial scapula winging. And there is also lateral scapula winging, which happens when your scapula is moving upward, which goes away from your spine. I often see patients with lateral scapula winging experiences clicking and complains about it. And also, it is not all the time, but I often see patients with lateral scapula winging also demonstrates noticeable rounded shoulder, which is positioning your shoulder joint rotating inward. Therefore, exercises will focus to improve those two postural deviations. So let's talk about exercises. The first exercise is called passive shoulder external rotation with scapula downward rotation. You can use any type of a stick. You can use a cane, a bar, or a broom, you name it. If there's a head, then you can grab that head with the side that you're working on. Use the other side of your arm to push the clicking side of your arm rotating outward. Your working arm should be bent to 90 degrees. When your arm is rotating outward, your shoulder blade or scapula should be rotating inward towards your spine. When you feel your chest muscle stretching and activating over muscles between your scapula and spine, then hold for 3 seconds and repeat 2 sets of 10 repetitions. The second one is called pectoralis muscle stretching with scapula downward rotation. Position your arm over the wall with your arm bent. Your elbow does not have to be 90 degrees. Your arm should be elevated as high as it can without elevating your shoulder. Once your arm is positioned right, turn your body towards the opposite side of your working arm. Turning your feet in the same direction helps to maximize the stretch. As your body turns, bring your scapula moving inward, basically towards your spine. Once you feel the stretch over the chest muscle, hold for 10 seconds and repeat 10 repetitions. The last exercise is called middle and lower traps activation. Find a corner and elevate both of your arms with your thumbs facing towards you and pinky fingers on the wall. You should keep your back straight and squeeze your scapulas slightly to your spine and bring your upper body forward. When you feel the muscle activation between your scapulas, that's exactly where you should feel the activation. If you happen to feel the activation over the lower back, then try to squeeze your scapulas more. More you bring your arms to the side, it'll be easier for you to squeeze. Hold for 3 seconds, then relax, and we'll repeat that 2 sets of 10 repetitions. There are multiple reasons for clicking during shoulder movement, and everyone has slightly different reason. I covered the most common intervention for the treatment. If you think this video helped, then please subscribe my channel, and thank you.